Right.
It's nothing I could have done alone.
And you guys are really now the number one in the United States, right? Or one of the top.
Geographically, we're the largest provider for interventional pain services in the United States.
It's pretty awesome.
We have approximately 50 different partnerships in probably 60 different locations. Now that we have this great team at PMG who are a lot smarter than I am, we're tracking other metrics as well. Other factors that will help improve patient care and our quality care. So that's nothing that I developed. I mean, it's where the team comes into play, and helps out a lot because I don't know most things.
So you saw the first problem, bumping into it with the hospital but kind of I don't know, not thing, you seeing what you think is the solution, but not having the supporting, and said, hey, maybe this can be done a little different way. And that you opened that door, and then you got the team to kind of rally around and fill in the spots where you're maybe not quite as strong. Is that?
Well, I think the concept was the following, in the sense that having a team that's focused on treating patients with like conditions. So if I took a team that also helped take care of cancer patients, that also helped take care of cardiology patients, and also helped take care of pain management patients, they may be able to do it, but can they execute consistently at that high level?
Mm-hmm.
I think you have to have a team that's focused on just pain, at least in pain management. I can't really speak for cardiology or for cancer and things like that, but just in pain management, you have to have a team that's focused on treating those type of patients. Knowing about the procedures, knowing about the medications. If the patient calls with a certain complaint after a procedure or a certain complaint after changing medications, being in touch with the patients, knowing them, from a phone call. John Doe called today, and I know John Doe. Yeah, how's he doing? They're familiar with the patient, and also they can anticipate what the needs are of the physician. So they work together very much as a team. In the end, the patient receiving the best care that they possibly can. So if you have a great doctor or a great nurse who interacts with the patient probably a lot more than a doctor does, but if the nurse also is in working in different departments, they may not be in tune with that,
Right.
just the pain patient. So we had to develop a program where let's get a designated team for that. That was step number one, educating them, this, that, the other thing. But that's the clinical part, but now we have, how do we expand this? If we are going to expand this to other markets, how do we formalize this? And that I don't know. I mean, in terms of, from a clinical perspective, I know what needs to be done. I know how our patients should do, but what are the other things that make it even better?
Mm-hmm.
And that's what the team really, took it to the next level, more so than I could ever do.
Right.
It's nothing I could have done alone.
And you guys are really now the number one in the United States, right? Or one of the top.
Geographically, we're the largest provider for interventional pain services in the United States.
It's pretty awesome.
We have approximately 50 different partnerships in probably 60 different locations. So we cover